Facebook land. Yes, it is your roving realtor, bon vivant, disembodied voice, John Pinto, here with Dr. Alex de Moreas. Alex, how do you spell that, please?
De Moreas. It's D-E space M-O-R-A-E-S.
Very good. That's a Portuguese name, huh?
Yes.
Very good. Pinto. There's a lot of Portuguese in Brazil.
Yep. Brazilian and Italian.
That's right. And we have a little bonus here. We have Juanita Ramos, who is my buddy from the Napa Farmers Market, selling me all good things soap-wise. I am very distrustful of big pharma, of big food manufacturing, even of detergents and soaps. Everything I buy is at the farmer's market because I can look at somebody like Juanita in the eye and know she's going to sell me good stuff that's not going to kill me.
And you're supporting the local economy.
Yep.
So
Thank you.
Great.
Thank you so
Our
much.
local farmers need it.
Thank you. Now, even though it's not obvious, Juanita is a somewhat reluctant participant here, but how could I keep her off the camera? She is so charming. I think she might be more charming than you, Alex.
I believe she is.
You think she is?
By leaps and bounds.
That's right. That's right. Now, how I know Alex is we have 45 guys that get together once a month drinking wine and eating a good meal, and I was fortunate enough to meet Alex. And Alex is a concierge medicine doctor, like that show that we all used to watch on TV, Royal Pains.
Yep.
Did that accurately depict what concierge medicine is?
It can in a lot of instances, yeah. It was a great show. I enjoyed watching it.
Mm-hmm. So tell us a little bit about your practice, what hospital, if any, you're affiliated with, your specialization.
Okay. So I'm a family practice physician, and I've been in medicine about 22 years now. And Juanita and I started in community health. Been in Redding, California. Eventually came to Napa and spent 4 years in Napa in private practice. With a change in the economy, we moved to Seattle and helped a large organization start a clinic up there. And then had the opportunity to not only get into concierge medicine, but move to Napa. With family being in the area, and about 4 years ago we took the stride back into private practice and concierge medicine. And in concierge medicine you care for a small number of people. You get to spend time. It's nice because you get to have conversations. It's really about the individual person. You're available to them 24/7, 365, which is nice because then it keeps people healthy out of the hospital. You get to focus on prevention. And then you get to really address those little things that many times don't come up in the office conversation, whether it be related to family joys, family stressors, genetics, whatever it may be. People have a tendency to be open to conversation. And knowing that you can come in today, if we don't finish, we can see you tomorrow or the next day, however many visits it takes to care for whatever your needs are. That's what it
And how do people find you? How do they retain you? How does that all work?
Finding physicians is normally through word of mouth quite frequently, and typically if you people who are interested can obviously look us up online in Napa or call our office. And it's been just a joyous trip coming back to Napa and reestablishing ourselves in private practice and getting to know the community. Additionally, I'm a medical director of a hospice organization in Napa. I oversee the care of 4 nursing homes. So we're really out there practicing some complex medicine in a variety of sectors where some physicians don't like to go, but it's rewarding and it helps families sometimes in their toughest times.
Which hospice are you affiliated with?
So I'm with Continuum Hospice. They started as a small hospice down regionally in Walnut Creek. Now we cover the Bay Area, and I became the hospice medical director because when they came to me and they were interested in a medical director, at first I wasn't interested because I was busy in my private practice, but I decided who can care better for my own, clients than me. And as the medical director, you're responsible for their care, so you're not passing it on to others to oversee your patient's care during the toughest time for them and their families.
In the meantime, can we continue this conversation with me refilling your glass with some 2012 Inglenook Cabernet?
Twist my arm, please.
Juanita, I'm going to put you in charge of that. So
do that.
Okay, very good.
The benefits of Napa Valley.
That's it. So let me ask you a selfish question.
Okay.
Despite my youthful appearance, I am Medicare with supplements.
Uh-huh.
Does your medical business have a nexus with Medicare and supplements?
We do. We're one of the few organizations that, as far as concierge, that do take Medicare. We take most insurances, not all of them. Sometimes it's challenging because some organizations don't want to work with concierge physicians. But we do provide care to Medicare recipients, TRICARE.
So, at the danger of asking a controversial question, I won't ask you to slam any healthcare systems, but I will ask you to name your favorite ones that you like working with and you think are good advocates for the patient.
That's a challenging question because each insurance organization has a tier, and it depends the tier which you buy into.
Mm-hmm.
The quality of reimbursement and support services you'll get. What's nice, with the benefit of my position and what I do, your insurance doesn't influence what I do for you. So whether you have insurance, have Medicare, or any other insurance, that has no implication on the level of care I provide to you. It's all the same. If you're my clients, whether you have no money, have no insurance, or have Medicare, you get the same thing that everybody else does.
Okay, so let's shift gears for a little bit. I'll tell you a little bit about some of my biases. As I alluded to, I trust corporate food, big pharma, as far as I could throw it. I feel that the standard of practice in the United States is eat junk, live unhealthy, and then load yourself up with terrible drugs. And it's a big conspiracy. You know, I'm very much old school. My dad never took any medicine. Everything was pretty much a Mediterranean diet. So let's talk a little preventative medicine, and I'll let you wax poetic. What do you think is number one? What would you advise our viewers to do in terms of maintaining healthy lifestyles?
If you look at all the studies, 30 minutes of physical activity a day is probably the most critical thing that you can do. Typically, most of my patients who are in their 80s and 90s and are still active and walking and exercising have the best health outcomes. You know, along our journey through life, sometimes we're dealt some cards that were unexpected, and that can influence your health. But it's the prevention that's important. So getting appropriate sleep, 30 minutes of exercising, weightlifting once a week, eating a modest diet. But there's a lot of factors that influence there because it can vary based on your genetic makeup. You know, we all know the person who's led a horribly unhealthy lifestyle but has lived to 100. And then we know supreme athletes who are marathoners and are, you know, vegetarians and exercise every day and have had a heart attack or something like that along the way. So you have to look at the entire person. It's their psyche, it's their physical attributions, it's their genetic makeup, and it's how they not only currently live, but how they have lived their lives, that you have to come up with a formula, and every formula of every person is different, and give guidance to better health. You know? So
would you say just taking a 30-minute stroll every day might be adequate in terms of dealing with that 30 minutes worth of exercise?
Yes, and if you look at all the studies, fast walking is equal to running. You don't have to run. So a fast-paced walking, at least 5 days a week, is superior.
That's 4 miles an hour? Fast pace?
Probably. It depends how fast your 4 miles are.
Yeah.
And you know, I always tell people, taking your dog and having your dog stop at every tree doesn't count as a 30-minute walk.
Mm.
And I have some people that say, well, I walk at work all day. Well, that's not an aerobic...
right.
It's
so
important.
me cooking for 2 hours a day, moving around the island of the kitchen is not going to cut it.
No, not unless you're going in circles for 30 minutes nonstop.
Oh, yeah. Well, my wife would have you think that I am going in circles all day long. I've been married 46 years, and I am intimately familiar with all of my shortcomings, of which I am reminded on an hourly basis with a new running total.
Oh, excellent.
Every day.
That's right.
Do you get weekly totals or daily totals?
No. Who needs a weekly total when you're getting an hourly total? That's, I think I'm going to go home and get beaten today for besmirching my wife's good name, Ellen.
But you know, it's meditative. If you can spend 30 minutes walking, whether it be many times it's hard to fit it at the end of our days because we're busy.
Yeah.
We've gone to work, we come home, we have family requirements. But even if you can fit it into your lunch hour or in the morning, I exercise in the morning because it's the only time I absolutely know that I can get it done, because things happen along my day.
Yeah.
And then you go, okay, I missed it, and I missed it again, and the next thing you know, it's 3, 4, 5 days, and it's gone. So,
Yeah. Okay, so that makes sense. I guess a recumbent bike could work out really good, huh?
any bike would work out great. Yes, if you have challenges with walking, swimming is fabulous too. The nice thing about exercise, it doesn't have to be what others do. It can be specific to you. So if you enjoy walking in the pool, or if you enjoy a recumbent bike, or just going for a walk or a hike, it's fantastic. It's just important to get out and do these things on a regular basis.
When I blew my left knee out in 1977 playing basketball, tried to see if I could bend it sideways. It didn't work out too good. So they told me to rehab. So I figured, all right, I'm going to rehab my whole body. So I went under Franco Colombo's regime. He was in Pumping Iron with Arnold Schwarzenegger. And he liked supersets, where you basically don't rest. You just go chest to back, chest to back, chest to back, chest to back. So you do 8 sets, chest, back, alternating. Then bicep, then tricep, bicep, tricep, bicep, tricep. And I used to keep the heart rate up pretty good. I think I got some aerobic. Do you like that kind of a weightlifting regimen?
That's really beneficial for people who are short on time.
Yeah.
And if you look at the extreme of that, it's called Tabata training. And in Tabata training, and there's not many people who can really do it, it's a minute on at maximum intensity, and everybody's maximum intensity is different. And then it's a minute at a slow, steady pace. So if you think about it, if you're cycling, you basically cycle really slow for 1 minute, and then you basically stand up and cycle for 1 minute. And then you keep doing that for 20 cycles or 20 minutes, and many times it's the equivalent to doing 45 minutes or an hour of exercises in different forms. So just it's important to pick what you do. Alternating too. So some people get bored. I always tell them, do the treadmill for 10 minutes, do the bike for 10 minutes, do any other item, whether it be in the gym or walking outside for another 10 minutes, and there goes your 30 minutes worth of exercise.
So I'll give you another angle on what I think is a great exercise, Pilates. I love Pilates because you start on your back, and that's a good way to start, and then you engage 2 of your bigger muscles, your 2 quadriceps, doing basically seated squats on your back. And then it's quite interesting in that you're doing the strength with all the movements, but you're doing a lot of stretching, and because you're moving, it's getting the heart rate up. What do you think of Pilates?
I like Pilates. I've never done Pilates. I've done some yoga, and yoga was extremely hard. I know Juanita's done Pilates in the past and really enjoyed it. But you're right, anything that engages, including engaging the core, but the strength training is really important. The beauty of Pilates and yoga and some of the other arts is that they focus on balance, and as we get older, balance becomes more of a problem because we lose muscle mass. And when you start losing muscle mass, it's almost impossible to recover it. It's not impossible, it takes a lot of energy, but we lose muscle mass if you're not doing anything.
So if you have a combination of losing muscle mass and you're putting on weight, then you're further at risk of falling and then getting a head injury or a broken hip.
Yes, or if something happens and then you get hospitalized and you're in the hospital for a week or two, you come out much weaker than you ever did,
Yeah.
than you were before, and that weakness is really hard to recover for the average person, because if you are a performance athlete, you're probably going to get it back, but it takes a while. Even when I've done a lot of my own surgical assists in the past, and I worked with an orthopedic surgeon who took care of some professional teams, and it was interesting because in the old days you had a shoulder surgery, there was a recovery period. Now they almost put you back into the gym right away because they know that if they leave you out for a week, you're going to lose an extensive amount of muscle mass, and that applies to all of us. So get engaged, get outside, make sure you have the appropriate clearance so you're not doing something you shouldn't, and then focus on balance and strength and aerobic activity.
Great. All right, so let's shift gears and talk a little bit about diet now. Last summer, I was pretty much down and out for 2 months with gout in both feet.
Ouch.
Oh, boy. I got a lot of work done on my Chase Lounge with my feet elevated. So I had the epiphany of committing to plant-based, which I did for 4 months. I just went nonstop plant-based. Thank God for the Napa Farmers Market. And I did find that that had a tremendous effect on the inflammation. So I know you're not a nutritionist, that's not your core competency, but you probably have some good opinions on plant-based versus inflammation. Can you enlighten us?
Yeah, a lot of what happens within the disease process has to do with inflammation and the inflammatory process. And there are a number of illnesses outside of just regular diet that create inflammation. So for example, if you have, I'm just going to name a few of many diseases, if you have inflammatory bowel disease or rheumatoid arthritis or psoriatic arthritis or gout or diabetes, these illnesses are pro-inflammatory. And then, for example, if you're a person who doesn't exercise, you add an inflammatory process on top of a diet that may not fit you personally or physically, it can certainly deteriorate your health more rapidly than it would otherwise. So changes, I've tried all diets because it's always fun for me to see what other people are doing. I've tried vegan, vegetarian. I learned to eat some fantastic foods that I wouldn't have eaten otherwise. I've eaten an all meat. I've eaten an all fat diet. Because when people come to me and they want to talk about it, it's important, I feel, to have experienced what it's like to have been in that. So diets are very specific. We have a registered dietitian in our office that we use for nutritional counseling. And diets are important, but it's also important in what you're trying to achieve. Because you may be on an amazing diet, but you're ignoring your health in a number of other ways. Mm-hmm. And all of that plays into the equation of being healthy or not.
Right. So, I've got an interesting meter. Yesterday when I was talking, Saturday when I was talking to Samantha Payon, who has California Pickle Works, Golden State Pickle Works. She was talking about how good probiotics are and plant-based diet. And I've got this oddball arthritic reaction on the middle toe on my left foot. If I'm going plant-based, it's quiet. Yep. If I don't go plant-based, I go to bed and it's barking at me. Just that little toe. Can you talk a little bit about that dynamic and how it might expand to one's entire body?
So that inflammatory process that you see on the outside is just what you're personally seeing. But your body inside is sort of in a battle, right? So you have the pro-inflammatory cells fighting the inflammatory process to try to keep it down, because all that irritation and inflammation and those immune modulators that the body releases in the process of decreasing inflammation damages plaque, it damages tissues, it damages everything, and that damage is what leads to part of our aging process. So anything you can do to mitigate that is important. So a plant-based diet in a lot of individuals, whether it be a personal choice or because of an illness, is critical. You look at liver disease, for example. Individuals who have liver disease who have gone on a plant-based diet don't stress their livers as much. In gout, as you know, if you're on a plant-based diet, there's much less chance of increasing the uric acids within your system.
I guess all my favorites: tongue, tripe, hearts, gizzards, kidneys, sweetbreads, that would not be considered plant-based?
You could use your third middle toe as a gauge on how much to eat and not to eat.
I think my middle toe will be going like those old movies when you see the RKO with the lightning bolts going out. I think that's the way it would be.
When the sheets hurt, eat less.
Well, I like that. When the sheets hurt, eat less.
Yes.
Let's run with that for a little while. When the sheets hurt, eat less. You know what?
So we should tell people what that means.
I think that's a book. Tell us, yes, please, wax poetic. So, when the sheets hurt, eat less. Go ahead.
So typically when people present to me with gout, I always ask them, does it hurt when you walk? Yes. And then I ask, does it hurt when you laying in bed and the sheets are touching your toes? And the answer is yes. And 99.9% of the time they have gout. Just because it's such a sensitive area, and I think until you've had gout, you don't understand what it's like. Basically, with gout, you get formation of crystals in the joint. So when you move your joint, it's almost like if you were if you don't have gout and you kneel on corn and then kind of try to do the twist while you're kneeling on the corn, I believe that's what gout feels like to most individuals.
I can tell you from experience, it's much worse. It's like the shards of crystals
Yes.
are shards of glass that are trying to escape the epidermis.
It hurts. It's horrible.
Yeah.
So when the sheets touch the toe, yes, it hurts. So typically when it's calmed down, you can now not only have a good day, but a good night of rest.
Good. So let's shift gears yet again. We talked a little bit about diet. We may come back to that.
We did talk about wine being anti-inflammatory.
Oh,
in
yeah,
modest
yeah,
amounts.
yeah. Oh, thank you. Yes, especially Cabernet Sauvignon from
Cheers.
Rutherford. And by the way, I would be remiss to not mention that Juanita and Alex do have their own wine that they make, Cabernet Sauvignon and Cab Franc.
Cap
We
Franc?
make Mount Veeder Cab Franc. We make a rosé of Cab Franc. We're making a Mount Veeder Cab and a Napa Valley Cab. And our first release is this year.
That's right. And I'm not volunteering, Dr. Alex, for anything, but I'm thinking that if you come up to Napa and buy a case of his wine, you might get one free medical inquiry question in, possibly, quite
Yes.
possibly.
Yeah. No, Majuscule Wine was started in the process of a group of friends of us, and it's been really, really fun because we're all health conscious. We all enjoy wine. We all enjoy travel, and it's those important things in life that at the end of the day, we all just want to be happy and healthy and smile and laugh.
Very good. So let's shift gears yet again. Another area of great skepticism that I have is, we're talking about the opioid crisis, okay, where you have this dysfunctional or functional system where, doctors, present company excluded, may be overly prescribing over-addicted drugs and people eating them like candy. Can you advise us on the importance of preventative medicine, staying out of those problems where you need to start taking a mix of pharma, and before you know it, you have so many complication problems and addiction problems, it just continues to get worse and worse. I'm sure you have opinions on that.
No, I do, and there's a percentage of my clientele that could and do significantly improve their lives through lifestyle modification. Diabetes. If you have diabetes, it's not curable, but we can certainly control it better. And you can go from a medication-controlled diabetic to a diet-controlled diabetic in many instances. And the same thing with cholesterol and high blood pressure. If you have high blood pressure and you are able through lifestyle changes improve that, many times you can get off medications. And I talk to a lot of people and they believe that once they start on medicines, it's forever, they can't stop it. It's not true. It's not true. It's true in some instances. It depends on your illness and disease. And my goal with medicine and medical care is I prefer to use the natural approach. If we can use medicines as a bridge, but if we have a choice to avoid medicines, it's always better because it decreases complications, there's less side effects. There's a lot of benefits to not having medicines as part of your regimen. Now, having said that, if you have an illness or disease that's going to impact your life long term and medicines are an option, if prescribed appropriately and monitored, it can be beneficial in a number of ways.
So let's talk about some of the basics in terms of medicine.
Okay.
How important is water?
Oh, super critical. Super critical. I think all of us don't drink enough water. We're all short on the water. I think it's very few people that drink the appropriate amount of water per day.
What might that be?
I knew you were going to ask me. I like to tell people that if you drink where your urine's on the lighter yellow, that is appropriate for you. Because, for example, if you're a roofer and a framer and it's 104 degrees outside, you may need, 2 gallons, 3 gallons a day with electrolytes. But if you're in the middle of Alaska in the winter and you're drinking 3 gallons a day, that in itself can cause what's called diabetes insipidus. So we've heard of people drinking too much water. Mm-hmm. That is actually an illness and a disease.
In general, would you say 8 times 8 is about right?
Most people say 6 to 8 glasses of water per day. If you're doing that, you're doing it.
Okay. While we're on the liquids, I'm a big artisanal tea drinker.
There's water in wine, you know that.
Yeah, I understand that. I am a big artisanal tea drinker. Let's talk now. Despite the fact that every time I do one of these vlogs, it's usually at Inglenook and I'm drinking wine. I don't drink wine at home. I'm usually drinking tea and coffee at home. So let's talk about artisanal tea, where chamomile, mint, peppermint, black tea, green tea, oolong tea. They say there's a lot of, what do they call it? Phytonutrients?
Phytonutrients and antioxidants, yes.
Antioxidants. How important is being a big tea drinker?
Well, whether you're a tea drinker or a coffee drinker or obtain your antioxidants in different forms, I think just the antioxidant intake is important.
So apple cider vinegar, shrubs, stuff like that?
Even just in your routine intake on a daily basis, the vegetables that aren't necessarily overcooked, there's a lot of antioxidants in that. A number of fruits have antioxidants. If you look at all the berries, they have antioxidants. If you're incorporating that into your diet, and whether it be tea or coffee, I think everything in moderation is going to be important. And some teas are caffeinated. If you're preferring to stay away from that, there's a lot of decaffeinated teas. But a lot of the green teas have a higher level of antioxidants and the beneficial products that help keep you. They're not going to offset a really bad day of doing something.
Right.
But consumed regularly, even if you look at coffee and coffee's benefits to brain health long term, and even alcohol. Alcohol in moderation has been shown to be beneficial. But the current guidelines say no more than one drink for women and no more than 2 drinks per day for men on average. If you're consuming above that, there's some possible risks.
What about if you order 2 drinks and Juanita orders 1 drink and she drinks all 3?
Then technically
Well,
I've had
that's a
no
good
drinks,
night.
so I get to order 2 more. It depends what drinks she's taking.
So we alluded to the plant-based diet. That's not for everybody. So let's talk about the pecking order. If you're not plant-based, me being Neapolitan, we live and die on crustaceans, cephalopods, clams, mussels, some fish. Can you enlighten us in terms of your point of view on what the best diet is?
I think a reasonable servings of fruit and vegetables per day, in the process of routine exercise and weight management, along with looking at your personal and family history and combining all that. It's really important, because if you're only doing one thing and not putting it all together, I think you're missing part of what really will keep you healthy long term. And a classic example is cardiovascular disease in women. We as physicians as a whole have really ignored cardiovascular disease in women for many, many, many years. And it's because there's a number of factors. And if you look, I think on average, women are better at doing exercise, they're better at taking care of their health through seeing their obstetrician and gynecologist. There's just sort of that promotion for health. Whereas men don't really seek health care until they're older. But what we've done is we haven't focused on cardiovascular health in women. And since women are living longer than men on average, their body is exposed to more of all those things that impact us on a daily basis. And what that leads to is vascular dementia, increased risks of heart attacks and strokes, peripheral neuropathy.
So that's like blood clots in the brain?
Blood clots in the brain, yeah. Heart disease, brain disease, leg disease, kidney disease. Those are all diseases that if we understand the individual health better, we can help people focus on that and make prevention. And there's some old tests that are coming back into trend that are helpful, because in looking at you, I can't tell what's happening inside your body. But if I use a combination of what you're eating, what you're doing, lab testing, maybe some imaging testing, and now you can actually do some DNA testing. If you put all that together, you can come up with a sort of a presentation. Here's, in any portfolio, look at what you do. When you have a client, you present a portfolio of options, right? And that's my responsibility to my clients, is to present a portfolio of options based on their risks.
So this circles right back around the concierge practice.
It does.
Of taking a multi-pronged, very progressive, multidisciplined approach to analyzing a client's risk factors.
Yes.
Or patient's risk factors.
A patient's risk factor.
Yeah.
Right. Yeah, and in a way, guidelines, medical guidelines are set by different colleges. So if you look at the American Academy of Family Practice, if you look at the American College of Rheumatology, they all have different guidelines, and they do it based on studies. But you also have to take those studies, because those are population studies, which might or might not apply to the individual. So if you look at risk factors of let me take an illness. If you look at risk factors for hypertension or blood pressure control, right? We knew that there's an organization that historically gave guidelines for blood pressure control, and they've revised those and changed it. So sometimes you have to go back to your patients and go, I know that was the old way of doing it. Here's the new one based on what we know and understand.
Sure, that happens.
Yeah.
Okay, so let's switch gears one more time, and that is with attitude. Attitude. Now, people always ask my wife, they say, what is he on? And my wife's answer is, he wakes up like that in the morning. Now, I don't want to appear too Pollyanna-ish, but I try to live my life so that every night is Christmas Eve and every morning is Christmas Day. I go to sleep with great anticipation, sleep like a baby, and wake up early and with enthusiasm, and I require very little to be happy. If I wake up, that's a good start. Okay. I have a personal opinion. As you can see, I have a lot of personal opinions that most people require way too much to be happy. They beat themselves up with these unrealistic expectations of what is required to be happy, and they're inflicting more damage on themselves than the environment and other people.
I think if you stop and look around what we have a lot to be thankful for and happy for. And today, there's a lot more stressors. And sometimes we fuel it ourselves, right?
Right, that's what I'm talking about.
We're all trying to be successful, and everybody wants to buy this, and they want to do this, and they want something else, and that creates stressors. And sometimes I wish I had your sleep patterns, because it does impact. And sleep's another big pro-inflammatory for individuals who don't sleep and are stressed out. But it's important to control and address all of those. And one thing I neglected is mental health. I mean, mental health has always been a challenge for many people, and it's good to hear that people are now conversing and talking about it, because it plays a role in everything we do on a daily basis.
So let's talk about the ability to calm oneself. Everybody runs into obstacles.
Yep.
It's inevitable. Sometimes you don't have control over the obstacles, but you have control over how you respond. Can you enlighten us on how to handle that?
Yes. The attitude that you just talked about, it's hard to focus on all the positives, yet address anything that may be perceived as negative. And I just had this conversation earlier today in a nursing home with a woman who's 59 and was recently diagnosed with cancer. And it was an incidental finding. She went to the hospital because she had a cough. And it was really great because she actually made me laugh. And we sat down and talked about it because she just had such a positive attitude. It's amazing. And if you look at cancer studies, individuals who have a positive outcome, a positive attitude, not only to their surroundings, but a positive attitude towards the treatment, they have better outcomes than individuals that don't. And that really ties back to your original question about inflammation. Because if you're happier, I truly believe that there's less of an inflammatory process within your body. I don't have a study to prove that, but happy people are just happier. Everybody wants to be around a happy person, right?
Well, I'll give you a little insight into me. My father had the misfortune of being born into Mussolini fascist Italy, so was subjected to the fascist youth. He had the misfortune of turning 18 in 1939 when Hitler decided to invade Czechoslovakia and Poland, and Mussolini said, "I'm in," and my father was drafted into the Italian Navy. He had the misfortune of the Nazis incarcerating all the Italian soldiers and sailors when the Italians deposed Mussolini, and the Nazis knew that their cousins in the United States were not going to fight Italians. And he had the misfortune of coming back to Naples after the Nazis left it completely destroyed, with no infrastructure, no water, no sewage, nothing, no power. And then he had the misfortune of being a longshoreman and being shaken down not only by the mafia, but Murder Incorporated, led by Anthony and Albert Anastasia. So needless to say, he had every right to be a little tense around the house.
Yeah, just a little bit.
And my way of dealing with that was with humor, so that kind of made me who I am today, always finding the fun in things.
Yeah, and that's important because I think our lives are stressful. I mean, even we have a fair amount of stress within our lives, but the other day we were just talking about how lucky we are to be back in Napa and doing what we're doing, and the fact that I get to see and guide people down their path of health is, I have to pinch myself every once in a while to go, wow. I'm lucky.
You are living a charmed life. We all are.
I'm very lucky. But I still have stressors. I have bad days. I have nights of poor sleep. I have, there's days where I'm upset like everybody else. But every day I have to sort of pick myself up and start over because people are counting on what I do and say to improve their health.
It's funny that you said that, because my advice to people, based upon my own experience, when they are suffering through the death of a loved one, is don't focus on your own misery. Focus on helping everybody else get through it.
Yeah.
And then you can kind of reset, because they need you. They need you.
They do.
Yeah.
They do. We all need each other.
That's right.
To help somebody.
And what we need to do is we need to go to our tasting inside the chateau momentarily. You like that Nexus, huh? So a couple of things to the audience out there. Hey, Lynn, how you doing? The other day I was doing a video blog, and Lynn's husband, Randy, said to me, Lynn is watching the Academy Awards, but I turned that off, and I'm watching the Pinto Hour vlog. So, Lynn,
Wow.
thank Randy for that. Thank you, Randy, for that. Mark, thank you for watching. I hope your knee is okay after taking that fall the other day. So for everybody that's listening out there, this is not the last video blog that we'll do with Dr. Alex. If you have any specific questions that you want us to cover, just go ahead and email them to me in the Facebook. And next time it'll be much more interesting talking to Juanita and her business about her. Does that cover soaps, and what else does it cover?
Goat's milk soaps, goat's milk lotions, whipped sugar scrubs, shave cream, and we're coming out with something new.
And what
But
might
I'm
that be?
not gonna tell
You're
you.
not going to tell me.
Exciting.
Oh my God!
You'll have to wait.
And we might be able to tap into her vast experience in the news business. Was it the news business?
Yes.
Yeah, just like Myra. I'm going to have to get you and Myra in on the same vlog. Myra's a good friend of mine who's from southern Louisiana. We talked about strategic corporate communications a couple of weeks ago. And we even got in a couple of Boudreaux, Gaston Thibodeau jokes.
Okay.
I always have to watch out for those because we're always likely to offend somebody with those. So, Alex, this has been delightful. It's the tip of the iceberg.
Thank you.
And could you just reiterate how people can contact you, whether it be by cell phone, social media, or email address?
So I think the best way, is to, if they can send you some information, I will reach out to them.
Very good. Well, everybody knows how to get a hold of me. And while we're talking about getting a hold of me, the disembodied voice behind the camera, do remember that I do these video blogs out of curiosity and entertainment. My real business is real estate. So if you're looking to buy, sell, exchange any real estate, especially if you're looking to create any kind of a family compound with an accessory dwelling unit and a junior accessory dwelling unit, I'm your Huckleberry. I can help you pull that off pretty quick. You can contact me at 408-829-4141. You can message me on Facebook. You can email me. at johnpinto@jvpinto.com. And if you have any questions of Dr. Alex or you'd like to connect with him, just go ahead and let me know through those vehicles. And thank you so much for watching, and I'll see you on the next video blog, which won't be too long.
And just quickly, if you have general questions, I can certainly address general questions. I can't address individual personal questions, just because I don't know your health, I don't know anything about your previous history. But if people have a question about general cardiovascular disease and prevention, and that might be a good topic for the future, heart disease and brain disease prevention, anybody who reaches out to you, please pass it on to me, and I will reply to them all.
What if I have specific questions about paella or feijoada?
So feijoada, I used to make a good feijoada. I'm going to have to work on it a little bit.
Oh, yeah.
Paella, I've tried a couple of times. It's not my forte. You have to know what you're good at.
It was an abject lack of success.
There was a lot of crust. There was a lot of crusty rice on the bottom.
You know, I like the crusty
That's the
rice.
best
No,
part.
it was black crusty.
Oh, black, overly crusty.
Yeah.
Very good. Okay, so we really do hate to sign off, but we have some
Thank you.
Blancano white blend waiting for us, some Zinfandel, some Cabernet Sauvignon, some Rubicon flagship wine, and who knows what kind of library vintages we may be in for.
Cheers.
Bye, everybody.